Okay, young kids routinely complain of tummy aches. We know this is all fact, but sometimes it can be even more than that. Dr. Greg Silverman joined us live to discuss. Yeah, the grandkids are in town right now, and we're
Good
feeding
morning.
them, and
Yeah,
we're
that's
doing
right.
stuff with them. It's the weather. I don't know. It's a lot going on, but
Right.
parents deal with this growing up with
Right.
their kids.
There are every kid has a tummy ache at one point or another, and the question is when do you really have to worry about whether or not their stomach ache is something significant or not? Generally, what I would say is if they have sharp pain, really severe pain, parents know their kids. If they have sharp pain, if they have nausea or vomiting, or if they have blood in their stools, certainly, that's a problem. If you have continuous pain over a couple of days, that's a problem. These intermittent episodes of stomach pain that says, I don't want to go to school, those kind of things, those are psychological problems sometimes, and you have to know your kid and understand, well, what is the underlying cause of this? Are they scared of something? Are they concerned about something that's going on in school? And so maybe it's time that you started talking to your kid and said, hey, why are we having these pains? What is going on here? If they can. If not, it may be time to talk to your physician and see if there's some help there.
When it's just a minor pain, there's different OTCs that parents want to give. Any recommendations there, things to avoid maybe?
Yeah, well, I don't know if there's anything to avoid per se. It's the same, that all these seem to work, which is Pepto-Bismol is generally well tolerated. Sometimes just plain old Tylenol. Feel your belly and say, okay, is there a pain all over the place, or is there a specific spot in the stomach where the kid says, man, this really hurts. That's the pain. Generalized pain, abdominal pain, is a little bit less concerning than sort of a sharp kind of, when I push on their belly, that really hurts. That's a little bit more concerning.
You mentioned some of the signs and symptoms, but is reflux one of those as well?
Kids don't get reflux a lot because that's generally one of the elderly or our age, or I'm not calling you.
No.
The last thing I want to do is call you elderly. That's not true. But the answer is that generally doesn't happen in kids. Sometimes it does after specific meals, those kind of things. Then you have to watch for, is the kid allergic to something? Is there something else going on? Maybe make a mental note of it happens every time we do this, or it happens every time we do this. That may be a trigger for your child. It may be time to talk to a physician as well.
Okay, Dr. Silverman, always a pleasure visiting with you, sir. Thank you so very much.
And
if you have a question for the good doctor here, go on and send us a text at 361-855-6397. Sir, we'll see you. Take care.
Have a great week.
Okay.